Okay, in this summary lecture today, we're going to talk about dental charting. The learning objectives are to know the syntax and symbols that are used for completing a dental chart. As you can see on the screen here, this is a full dental chart with both primary and permanent teeth present. This chart has the exact tooth number written on it, but as you can see, it's almost like the arches have been flattened. So the midline intersects right down the middle here. And if I draw a line across here, you can see up on our top left-hand side, we have quadrant 1. And then over here, we have quadrant 2, quadrant 3 down in the bottom right-hand side, and then quadrant 4 over on our left. You can then see this continues around with 5 for our primary teeth, 6, 7, and 8. You can see through the middle of the screen, we have our central incisors, and then as the teeth increase towards the posterior teeth, it goes out towards the outside of the dental chart. In terms of tooth surfaces, it is also like our arches have actually been flattened. So if we imagine our arch like this, and then we swung it out this way, it means that our distal, which is the most posterior from the midline for just say quadrant 2, is going to be the furthest away from the midline. So that's going to be this surface here, this surface here, this surface here, this surface here, and similarly for down in quadrant 3. Then if we're talking about quadrant 1s and 4 on our dental chart, our distals again are going to be the most further away down here. So then when we think about our mesials, change my colour, they're going to be closest to the midline. So for our 1-1, this is our mesial, 1-2, this is our mesial, 1-3, our mesial, 1-4, and same in quadrant 4, closest to the midline. Then for quadrants 2 and 3, it's going to be these surfaces here. So similarly, when we think about where our buccal and lingual or our buccal and palatal surfaces are going to be, we need to think about as if these arches have been flattened. So if we think about the outside surface being the buccal, or the ones that are touching the cheek side, for quadrants 1 and 2, that's going to be these surfaces across here. And then similarly for quadrants 4 and 3, it's going to be on the outside here. This is our buccal or our facial surfaces for the incisals. We think about our lingual and palatal, just imagine that the tongue was here. So if I change my colour, our palatal surfaces for quadrant 1 and 2 are going to be on the inside of the chart here. And then for quadrants 3 and 4, the opposite. The inside, this will be the lingual, closest to the tongue. Now for our incisal edges, you can see that they're a different shape from our molars and our premolars. And this is going to be the incisal edge across here, this little straight line. The occlusal surfaces of our molars, you can see, are this square box on the inside, which is the same across all of the dental chart. Okay. So let's have a look at individual marks on each tooth. For a dental chart, we always record in black. So for a tooth that is not present, so we haven't extracted it, the patient has turned up and it's not in their mouth, what we need to do is just put a straight line across the middle, like this. If we have caries present, what we do is we circle on the tooth chart where the caries is located. So in this picture example, it's just on the occlusal surface. So we would circle like this. So that indicates to the person doing the treatment where it is located and how many surfaces it spans. So if it spans multiple surfaces, you're going to circle all of those areas. For a restoration that's present in the mouth, so this one, for example, this is a permanent maxillary molar, and it looks like if this photo was not taken with a mirror, it's taken in the mouth, it's a 1/6. If we were charting this, we're going to chart the exact surfaces that it's on. So we can see it spans the occlusal fissure surfaces and goes towards the palate. So we try and mimic as best as we can the surfaces and the shape of the restoration that's in the mouth. And then we colour it in to signify that it's already existing, it's already in the place of the mouth, not for us to complete. For a temporary restoration, so we can tell that this material here is not a permanent restoration like composite or amalgam. It's got a particular texture and look to it, so I'm able to identify it. We circle like we would for caries or a restoration, but to signify that it's temporary, we put these crosses like this. For a crown that's already existing, we simply put a C. For a crown and bridge, for the tooth that's missing, so in this example here, this molar is the one that's missing between these two teeth that it's being anchored by. We put a cross through the one where it's missing, and we put B for bridge, and then the two crowned teeth, the teeth that are still existing there, get C's on them as well. For a tooth to be extracted, so it's been treatment planned, we put a diagonal line through it. Then when the tooth has been extracted by us, what we do is we put a cross through it like this, and then another diagonal line to make a full cross. So that's when it's been done by us. If there's a fissure sealant, simply do an F and an S on the occlusal surface. If a root canal treatment is planned and needed, we simply put a triangle that has not been coloured in, empty like that, over the top of the tooth. And then one that has been root filled, so we might actually identify this with a radiograph or an X-ray. We'll put a triangle and we'll colour it in, just like we did when there was a restoration that was already existing. Okay, so let's have a look at this example. When undertaking tooth charting, you should be systematic. So I usually start to tell the person who's recording, because it may not actually be you for infection control purposes, what teeth are present. So if we have a look in these pictures, that you can see that there's a lot of primary teeth present. So we're going to need to identify which permanent ones are present and which primary teeth are. So I can see that the 1/6 is present, and then there's all other primary maxillary teeth. So I'm going to cross out all the other permanent teeth. And then in the mandibular arch, I can see that almost all the primary teeth except for the 3-1 and 4-1 are present, and no molars this time. So I'm going to cross all of these out. And the deciduous central incisors that are missing. Now having a look at these photographs, I can't see that any restorations are present, so I don't need to mark any of those. But I can see that there are some caries present. I can see that on this 5-5, there's only by the position that there's a small tooth fragment remaining. So I'm actually going to mark this one to be extracted, that tooth fragment. I can then see on this 6-4 disto-occlusal and the 6-5 mesio-occlusal some large carious lesions that I'm going to circle to be restored. And then in the mandibular arch, I can't see anything else that I should be recording. So let's do another example. So I can see that there are permanent teeth and no primary teeth present. So I'm going to straight away cross out all of my primary teeth. I can now see that there's a premolar missing in the maxillary and the mandibular arch. I'm going to say that the 5s are missing and we'll cross them out of our chart. This person's obviously had orthodontic treatment because you can see that they have a fixed retainer, but also that there's no spaces where those teeth are. So you do need to be going around and counting all of the teeth. So in terms of restorations that are present, I can see that lots of these molars have existing restorations. I can also see, which I haven't recorded yet, the wisdom teeth, or the 8s, aren't present in these photographs or aren't erupted. Perhaps if I took a radiograph, I'd be able to see that they might be underneath the gum. But now I need to tell my dental assistant, or the person who's helping me recording the dental chart, which restorations are present. So the 1-7 has an existing occlusal restoration. It's difficult to see here, but the 1-6 has a disto-occlusal palatal, so 3 surfaces. Continuing around, the 2-6 has an occlusal, and the 2-7 has a disto-occlusal buccal. So the 3-7 has an occlusal. I could probably also tell my dental assistant that it was in the shape of a cross like the Fisher pattern. And similarly, the 4-7 also has this type of occlusal restoration.